Hello and welcome to the JCN Clinic podcast show. I'm Jessica.
Carissa.
And today, Carissa and I are frothing with excitement to have Danielle Renee with us, who is the founder of Bobbie Charles Empire, loving that, who is a dermal therapist, speaker, and business consultant. Many of the things. So welcome, Danielle.
Oh, thanks, Jess. I'm so happy to be here. And thanks, Carissa. I just can't wait to share some value for the people that are listening.
Now, I meant to ask before we got started, do you prefer Danielle or Danny?
You can call me whatever you want. I answer to lots of things.
Love it.
But Danny's fine. Danny, whatever.
Okay. So, Danny, do you want to give our listeners a little bit of a background about yourself and Bobbie Charles, just for those who are unfamiliar with Bobbie Charles? I'm sure there'll be lots of people who, as soon as they see today come up in their feed, will be like, oh, click. But for those that aren't aware, can you speak a little bit to what your background is and what you do?
Yeah, so I'm a dermal therapist by trade, and I've been in the aesthetics industry for just under a decade now, so showing my age. But yeah, I've got a real big passion for skin, wellness in general, and just getting the most out of our lives. I have the two clinics, so one in Lutwyche in Brisbane on the north side, and then one in the beautiful West Village Centre in West End, on the, would you call it the, it's like, you know,
west side?
Yeah, west. Oh, I could make the biggest joke right now. Bloody Westies. No, yeah, so I have the two clinics that are available for people to come and see. But yeah, essentially that's a bit of a background about my passion and what we do.
Wonderful, wonderful. So I thought we'd get started today with, because Carissa and I have got lots of questions that we're dying to ask you. But before we dive into that for our listeners, we wanted to give some perspective today as far as skin and what we do at the JCN Clinic and common presentations that we see, and how we start to look beyond nutrition and supporting the skin in other ways with other therapies, inclusive of what you do. So, Rissi, do you want to speak a little bit to that as far as how and what we do at JCN? Just, I know that's a big question, but just a bit of a summary as far as what we see with skin at the clinic, and how we start to look beyond just nutrition.
Yeah, for sure. So skin, such a little favorite space, isn't it? We see a lot of it. So I guess there's probably two camps we could break people or our clients up into when it comes to skin, that we talk about in the clinic. We have our clients that come to us specifically for skin concerns. So a lot of that is acne, pimples, rosacea and redness, eczema, psoriasis, rashes and things like that. So we definitely have, I feel like, quite a large demographic of people coming to us with actual skin concerns and complaints. And that's what we're helping them work, I guess, from an internal perspective, helping them work through what may be the causes of that and trying to get outcomes for them. And then we have clients that I feel like skin and aging is just part of their overall health goals and plans as well. Like, I know even for you and I, Jess, this is something we love to sort of talk about a lot. But even just with our clients, you know, when we're not actually dealing with a skin concern per se, something that we are really, you know, or just open conversations with clients that are just more like friends sometimes. It's like, cool, what else can we be doing to age in a really healthy way? And how do we get the best of out of our skin as we age? And that is something that I'm always chatting to my clients about, like, what supplements should we be taking, what sort of foods and food, you know, lifestyle / air quote diet, but you know what I mean, like what sort of like lifestyle and food adaptation should we be making to make sure that our skin does look good and glowy and youthful and fresh, as we get all the little keywords there. But it's so true, because I feel like, you know, that's a lot of what I spend time talking to my clients about as well, because I 100% believe that if you're healthy on the inside, it shows in your skin. Like, I spend a lot of time, and I don't even mean to do it, but I do. I'm such an assessor when I look at someone. I get in trouble from it from my girlfriends all the time, because apparently I look like a judgy bitch, but I'm not judging. I assess I assess health when I look at people. It's just programmed into us as what we do for a job. But part of that is I always look at people's skin. Like I do. I look at how hydrated they are. I look at, does their skin have a glow to it? Does it have any dry patches? And I'm looking at it from an internal point of view. I'm not judging aesthetically or anything like that, or making a gauge aesthetically. I'm literally looking at it from, well, to me, that says, how well do you eat? Are you having a lot of sugar in your diet? Is there potentially some imbalanced hormones? Is your gut health not up to scratch? So I feel like I can tell a lot about someone by the way they present sometimes. And I love that. I just love being able to do that. But I do think, there's so much from an internal point of view that we work with it in the clinic that comes through in our skin. But this is why I also love the space that you work in, Danielle, because I feel like the two really complement each other.
Yeah.
Yeah. And I have learned that. I've learned that so much in the last probably 5 to 8 years. I feel like in my teens and 20s and probably even early 30s, I probably didn't do a lot for my skin. And my sister did everything for her skin. Like you and her, my God. My sister and I had a thing when we were about 15. I think I have chatted about this on a podcast, and we call it our face off, where she has
mentioned this to me before, actually.
She has gone down this road of just so much time and money into her skin. Like she has never spared an expense for skin products, never spared an expense for certain types of facial skin procedures, cosmetic procedures and things like that. And we're both a year apart. I'm 40 this year. She's 39. And it has paid off for her. I am not going to lie. Like I've always kind of just stayed with the less is more approach. And I still have the less is more approach, but now I spend time and money on my skin and I invest in things like what you do. And I totally see the value in it. And I have 100% seen a change in my skin, which I always thought my skin was really good. I've always taken good care of it because I've taken good care of my insides. But since upping the game, I've noticed such a significant change in it as well, which is why it just, brings home that if you do the two combined, I believe that there's so much more.
You're doing them we'll get into that. But that's the whole holistic approach. There's no one thing that's going to fix everything.
Yeah, exactly.
There's no quick fix. There's no one pill. There's no one. Everybody's looking for that, I know, but no.
Nope. So I guess, sorry, Jess, you go.
I was just going to say, on that, not really a side note, but I was just curious. I imagine you see a lot of that, Danielle, with what you do. Like Carissa speaking to that, like internal, looking after yourself, nutrition, wellness. Like you would have people coming to you with the health whether it's like health associated conditions, we I guess call them things like rosacea or acne, but even through to just wanting to take better care of themselves and conscious of aging. I imagine you would on that side of the spectrum also be having conversations about like wellness, as you just said, and that more holistic approach. Absolutely. And nutrition.
Yeah, absolutely. So in our consultations, and I really firmly believe that everybody should start on a consultation, because you should really, as a dermal therapist, we should plan always before we treat. And, that eliminates any sort of risk to the treatments, but it also gives the clients a plan and they know kind of that certainty of how long they're going to be on this plan. And it just, I don't know, it gives them that, I want to say, I come to you, sorry, Carissa, I come to you for accountability. Sorry, I was missing the word. It gives them that accountability. So we look at ourselves like skin coaches, if you will. And I really think that everybody needs accountability in the areas that they're not so strong at. Like for myself, I have a team of health professionals. So I've got my psychiatrist, my psychologist. I believe everybody should have them. And then I've also got you guys that look after my nutrition. I've got, it's just like my healthcare as a team. But I definitely think that everybody should start from the consultation process so we can find out those things. And our consultations are actually 45 minutes to 60 minutes with a client. And sometimes clients will think, I don't need a consultation. I just want to start my journey. But for me as a practice owner or a clinic owner, I often think that that's quite risky. I'm like, they're probably not our ideal client. We want people for a really long time to be able to look after their skin at all different times of their lives. So they could be going through stressful times, pregnancies, menopause, post-pregnancy, like all those different things. So you need to treat the skin differently at different times of your life, especially as a woman, as we know. So during the consultation process, we really break down. We even look at, again, we're not nutritionists, but we even ask them how often they go into the toilet, the bathroom, how is their gut, how is their, because of course we then recommend to you guys at JCN. We look at hair loss, we look at their diet, their sleep, how much do they drink, what's their stress levels, because I can do all the treatments in the world and use everything in my toolkit. But if a client's not, that we both have to meet halfway, and it is a real collaboration in regards to getting the results that the client wants. So understanding that client and understanding at different stages of their life what they need. Because Jess, if you came into me and said, I've got a wedding coming up, I want to, turn back a few years of my life, which I can do for you in 3 to 6 months. If you're really stressed before the wedding, right before the wedding, we can actually cause more trauma to the skin. So for me, I just need to always manage, like even if you're on your flow at that time, like your period, your menstruation at that time, your skin's going to be a little bit more sensitive. So I have to modify the treatment to make sure that it's safe and effective. So we're always consistently every time consulting again at each time that you come in. So it's, for us, it's the consultation process is very important for safe and effective treatments.
I love that. It so aligns with how we practice as well. It's just
Absolutely
so interesting, obviously providing different services. But at the end of the day, it's like looking at optimizing those outcomes, and like whether it's someone coming in and working on their nutrition and well-being for skin in one area or the other, like that central core is so focused on making sure that we always refer to it, the foundations are the best that they can be, and then individualizing treatment. So that you're going to get the best results, and also that you won't create any sort of negative results or flare-ups or inflammation, where if the right questioning or consultation process could have like prevented that from happening. So I just adore you do that.
Oh, thanks, Jess. And I take a lot from Carissa too since collaborating with you guys. I've always had that kind of philosophy, but that's why powerful collaborations are so important, because you strengthen each other, right? Carissa, when she's working with me on my stuff, I'm working with, would you call it chronic fatigue, burnout, whatever it is, with my stuff. Just so our listeners can kind of get a little bit of a foundation of what we're working through. In my test results, Carissa, correct me if I'm wrong, my testosterone was down, right?
Correct.
So libido was low, like it's showing all those signs. So of course, naughty, I talk about don't do it, but I'm like, quick fix, like I've got shit to do. Like, what can I get on? That's the fastest thing. And Chris is like, we're going to supplement first and all of these things. And I'm like, I found out there's patches. I'm like, I'm going to get on these patches, but they're from the States and everyone's raving about it. And I'm like, well, I did like a lot of research, but of course I go through Carissa because she's my accountability buddy. And she's like, and going back to what you're saying, Jess, is I don't want, right? She whipped me into line, which I love. She's like, I don't want to give you this because then if you spike it too much, it's going to cause problems over here. And it just made sense. And I guess that's where it comes back to patient and client education, right? Is us to be able to educate the person on what can happen when you have a really quick fix and you're looking for that fast, speedy response.
Yeah, so true. Wow.
Testosterone patches. When I read your email, I was like,
it's like, how do I put this nicely?
Not right now. Only because I've seen testosterone patches for women. I can't remember how much I said in the email, but I have seen them do some nasty things for some women. And I was just like, I don't want that for you.
No. And I'm actually feeling like, as I mentioned to you before we started filming, I'm feeling better anyway, just from which I want to go into on this podcast with you guys, just from making like these small, actually they're not small. I'm not going to say small because they're fucking huge, excuse my French, changes that I've made this week. And honestly, my mind, my clarity, my delivery, even with my speech, is just so like my brain is just functioning really well.
That's awesome. So fantastic.
Yes, I know. Wow. Carissa's like I've got my that you prescribed. I've got my theanine, my tyrosine, theanine,
magnesium and bees.
Yes, all in this bottle.
Yeah. Oh, all in that.
Oh, in your water bottle.
I do it in the morning.
That's the perfect little combo. Yeah, that's so fun.
Yes, it's great. It's honestly, I actually, Shakaya, my clinic manager, I've just ordered some L-theanine for her as well, because it honestly just your brain.
Yeah.
It's just so good for focus.
Yeah, theanine's beautiful, and tyrosine. And just for everyone listening, please don't go out and take this randomly in case you need it. But for people who do need it, theanine and tyrosine are just two beautiful little compounds that I love to play around with.
Yeah, well, she was just forgetting everything all the time, and she's my clinic manager. I'm like, Dulls, fish oil, theanine, tyrosine, get on it, because I can't. For a long time, she's just been like, I can't remember what I did yesterday. I'm like, I need you to remember.
Yeah, I need you to remember. It's kind of important.
Anyway.
Well, let's get into picking your brain, let's call it, about skin therapy, because as Carissa was saying earlier, clients come to us on a spectrum, but we often will have conversations about other therapies. Sometimes they're already working with someone, but a lot of the time I would say they're not. And we're looking at what else we can do, because we can do heaps, like we can do so much, but it can get to a point where we can see that bringing on other therapies can be really beneficial. Or again, we've talked already about like even aging, and we do have those conversations with our clients, and clients ask us this stuff. And I guess just quickly, Carissa and I talked about this as a podcast topic last year, and we thought it was really important to talk to yourself and to have this open conversation, because our female clients want to know this information. They're asking us about different types of therapies and what, you know, whether it's about our opinion or like what information we have about them, safety, etc. So yeah, I think it's a really, really important topic, and a lot of our female listeners are going to be so excited about this. So I thought we'd start with, we want to get into the different treatments and move through those, but even first, if we started to talk about how we can choose the right products for skin types, whether that, and I know that might be probably the huge loaded question, but you know, whether it's someone who has a lot of inflammation in the skin through to someone as far as aging, like where do they even start? Because people will come to us and ask Carissa and I these questions too, and we're just like, we don't know. Like we know a little bit, but it's not our, call Danielle, go see her, don't ask us.
Yeah. And I think, again, it comes back down to the consultation, right? Like I need to understand the client. It's like if I said to you, what can you prescribe for this client? Well, you don't know what you don't know. Like I need to ask them questions in regards to, like I need to see and feel the skin. Not always. Like we do at Bobbie Charles, we do virtual skin consultations. So like this. So I can already see with looking at your different skin types now, what's going on within your skin. Like, yes,
let's do an analysis.
No, not live. I can, but it's more for you guys. I don't want to be like, hey, this is what you need. I'm happy to. Well, Carissa, we're already looking after you anyway. But going back to the question is, again, I just need to see and feel the skin and firstly ask what the concerns are. Because people often overcomplicate skin and talk about, there is an importance of knowing where it's coming from, of course. But for me, it's like it's already there. Yes, we want to know how long it's been there. Is anything that makes it worse? Sun, heat, certain foods. But for me, as a dermal therapist, I want to treat what I see and also what's could be underlying. So I'm thinking about gut health and all of this, but I pass that on to you guys. So for me, let's break down, I guess, the skin concerns. I am conscious we only have an hour, but if we break down the skin concerns, like if you've got somebody coming into me, I'm going to put impaired skin under one shelf, so to speak. So if you've got rosacea or impaired skin would show like dry, flaky, very prone to redness. So when you go in the sun, you go red. Even when you touch your skin, you go quite red. Putting on makeup, you're needing to camouflage redness. For me, that's an impaired skin. So when that presents to us in the clinic, we're always thinking barrier health first. So if somebody came in, like you, Carissa, if you came in and you were concerned with redness, impaired skin, rosacea, etc., or even inflamed acne, you know, when you get acne and it's just red and it's angry, any sort of angry stuff like it. But if you're concerned with aging as well, all of my therapists are trained in barrier first. So I'm not even going to think about your aging concerns, because I'm going to get your barrier performing the way it should. So keeping everything out that shouldn't be in, and keeping everything in, hydration, etc., lipids, in the skin. Because when the skin's performing the way it should, you're actually going to reverse the signs of aging anyway. So as a byproduct. So what can happen in our industry, if you come in and you say, I'm concerned with redness, but I want to turn back age, a lot of people will then go and get straight into your high strength acids, which then, of course, it's for me, I don't want to say it's common sense, but it's like, of course, if you're introducing acids really fast, you're going to cause more pain to the client, more concerns. That redness is going to be worse. And it's really hard to reverse redness. It's one of the hardest things, like rosacea, impaired skin. When it's bad, it's really hard to reverse it. So for us, it's always go low and go slow, look after the skin first, and never jeopardize the skin health no matter what. So if a client comes in and says, well, I don't want to treat redness, I'll say, I'm sorry, you're going to have to see somebody else, because it's not our philosophy. So that's if you look at like an acne, leave out acne for now. But if I'm thinking really angry acne, we can put it in there. But then if you look at rosacea and impaired skin types, all you want to think about is nurture. If you've got a broken arm, so I love analogies. If you've got a broken arm, you're not going to go to the gym and train upper body. Like, you're going to nurture it like your foot, Carissa. So you're going to want to nurture it, right? It's the same thing. If you've got red skin, nurture it with nurturing products. Now, I don't want anybody listening to get overwhelmed on the actual ingredient types, because for me personally, see a professional. Don't go online and do research. You can do your own research, but trust somebody that does what they do really well. And I'll go into how to actually find a clinic that you can trust, what things to look for. Trust them, and then you can do your research, because there's things like niacinamide and zinc. Combine the two. Extraordinary. You can get zinc and you can get niacinamide, like those kind of products, vitamin E, vitamin K, all of those kind of things that are going to really help to, strengthen, soothe the skin. So that's if you've got like a red and rosacea impaired skin. Even with acne, if someone presents with acne, a lot of now I don't blame anybody in the industry that treats like this. So if you're a dermal therapist or beauty therapist listening to this, please know that it's not wrong what you're doing. It's just a lot of people haven't been educated in the way of, if an acne client walks through, they'll get them straight into chemical peels, or they'll get them straight on high strength vitamin A's, and the skin is already traumatized. So you have to look after the barrier first before you go introducing all of these, salicylic acids and stuff. This is why, again, I'm not against Mecca. I'm not against Sephora, but these people are trained that salicylic acid is really good for acne, which it is, but not straight away. So when a skin is really angry, when you're introducing acids, it's going to make it angrier. So you just need to work on that foundation of that first month, 2 months, maybe 3 months, maybe if it's really bad, stage 4, stage 5, to bring the anger down, and then you can start hitting it with some higher strength acids. But that's a process. So some people might go, oh, I'm not getting the results from you because it's been 2 to 3 months and I've still got acne. Yes, I'm looking a lot calmer. And then they'll go somewhere else, and then they'll get incredible results because we've done the prep. So for us, it's all about, I say that to people in my consults, hence why they're 45 minutes to an hour, because you have to educate them on when you're going to see results and when likely we can do that next stage. This is the prep. Your next stage will start as soon as your skin is ready.
Yeah, but that's so similar to what we do as well. Like, even just using acne as a presentation, we see the approach you take is the approach we're taking. We're talking to our clients. I'm like, your skin is the end result of X, Y, and Z going wrong in your body. So for me to help effectively reduce what's going on here, like, I'm going to have to go in and and that's what we cover in our initial consultation. I'm like, what are your core in drivers that are contributing to this skin presentation, and here's a realistic time frame of when I expect you to see results. And for some clients that might be 6 months. I'm like, we might be able to reduce some redness and stuff and working with a dermal therapist and things like that, but you've got gut issues, you've got androgenic hormone issues, and you've got an autoimmune thyroid. Please give me 6 to 12 months if you want to do this properly.
Yeah.
And it's a big conversation that Jess and I have with our clients as well, because realistic timeframes to do things properly. Usually by the time people come to you screaming, that's the end result of their body that has been telling them for ages something's not right. And it's, so it's speaking about skin barrier and just things that shouldn't happen in the skin industry. Here's one that will probably make your skin crawl. I had a client about 18 months ago. No, longer than that, maybe 2.5 years ago. She's not in Queensland. And we were working with her acne. And she, before she came to see me, had been seeing a different practitioner, shit tons of supplements, not a lot of diet. She worked just the kind of basic, like take dairy out of your life. And she was working with a skin clinic who did Dermapen. And I don't know if this is right, but to me, just what you were saying then about the skin barrier made me think I didn't feel like it resonated at the time, but wanted to do Dermapen over the top of her acne. Right. But when it was like, I get it when it's healing and we're trying to, re-influx collagen and heal and promote a healing. I get that. But this was like initial angry stages. And they're like, oh, we'll just put some peels on and do a bit of Dermapen over. And I'm just like, oh, I just don't feel like that's the right approach. Like, I'm not an expert. Yeah. So just when you were explaining all the stuff about the barrier then and just working on that first, that just made me think of, what not to do.
Yeah. And again, I never want to make anyone feel bad because, we can only do what we've been taught. But yeah, it's definitely not the approach that I would take, and nor anyone in my clinic would ever take. But yeah, you actually know so much about skin, Carissa. Like even the way you talk with needling, knowing that you want to, get rid of that scarring and stuff after, to produce that collagen, elastin, etc. It's exactly when you would use it, when you've got that scarring that's left over.
She's like peacocking. Love it.
I'm like, I know my skin.
Yeah, you actually do. It's awesome. You guys mentioned before that, when you, I think it was you, Carissa, and you said 6 to 12 months, to get them the results that we need, which is so true. But that's why I love this kind of collaboration, because imagine if you were working with them and I was, you could get them results in half the time if they're doing everything correctly at home. And like, that's where like one of my favorite treatments of all time, and everybody should, I firmly believe, and it's not because we just offer it, everybody should be on an LED membership. So you can just come in and use it whenever you want. Like I wish that I could take the LED or afford one at home. They're like 30 grand, the ones that we use. I wish that I could take it in the car and just take it home, because I hate going into work just to do an LED because it's half an hour. But it honestly gives you the best results. Like I was getting some perioral dermatitis just from stress, changes in my diet and stuff that I mentioned before we got on live with being unwell. So I was just getting that flare up and breakouts, and it literally just heals it so quick. But not only does it heal your skin, it's just glowy, it's plump, because LED's working on things that are living. Whereas product that you're putting on topically is working on dead skin, right? So it's like, well, there's controversy if our skin on the outside is dead or not in the industry, depends who you talk to. But the product's working on the outer, and then your LED is really working on a cellular level from a whole systemic approach. So it's not just about skin, it's about oxygenated blood flow. I mean, this is, correct me if I'm wrong, it's in your area of expertise, but you just, everything is circulating better, everything's functioning better. And it's not just about when you come into the clinic and getting a quick fix, it's ongoing. Because if you think about our cellular, I don't want to get nerdy. I promised myself I wouldn't get nerdy.
No, get nerdy.
Is like, if you think about like cells are always communicating, they're always replicating, they're doing everything that they need to do to keep us fucking alive, right? Firstly, but it's like, everything, when you hit it with a really good LED, because not all LEDs are created equal, and I can go into that if you like, but if you hit it with a really good LED, it's like putting an iPhone on charge. It's just working at a rate that it should. So, and it's beyond just that first treatment. It's an ongoing thing. like there's even studies, we did some, we didn't do the clinical studies, but we researched and combined a heap of clinical studies. There's research out there. And I feel so honored that we do it to some patients at BC as well. When they're struggling to get pregnant, that LED is really good for infertility. Yeah, so we actually put it, rather than putting it over the face, we put it over the ovary area, and it's meant to be done every second day. And we've had some really good cases with that as well.
Do you know what that makes me think of is acupuncture and like when you do acupuncture and you use moxa at different times of the cycle to really get that heat and circulation into that area. Like just, yeah, it's just fascinating as far as like how they kind of resonate with each other.
Yeah, definitely. But yeah, so LED is one of my favorite treatments to do. But going back to what you guys were saying, because I'm thinking like what you guys see at JCN, no matter what it is, pigmentation, yes, LED is not my go-to. But if you're working with acne and rosacea, which you guys see quite a lot, LED 150%. If you can't come into Brisbane Clinic, obviously you go to any clinic that's got a really good one. But we actually stock one that you get from home. That you can use at home. I won't sell it to anybody that I see if I'm like, will you actually use it? And a lot of my girls are like, nah. So just come into the clinic, don't waste your money. But if you are someone that will use it, like me, I use it twice a week at home, and I still use the one in the clinic because you just can't compare like a $30,000 device to the one that we stock is $799 retail. And I've used ones that are $300. I've used ones that are $1,500. And this one, you can actually feel the heat in it. And not that it's a heat device. You can feel the cells doing what they're meant to be doing to activate. But we can link it in the show notes as well. I think LED is an incredible treatment that everybody should be using at home.
I feel like LED is something for my clients that I have seen amazing results with when I've recommended them to source especially if they're Australia wide, so not in Brisbane. So if they're just over the years for rosacea and redness in acne, like LED, it's just a game changer. But I feel like I know we're not going to go down this rabbit hole today, but could we do LED for endometriosis clients?
Yeah, well, I mean, I don't
could there be a space for this? Like, is this another thing that we haven't untapped yet?
Yeah.
I think that personally, LED, okay, we should have definitely had an hour and a half. But I'm happy to stay as long as we need, so long as we're adding value where we can, right? LED is used in so many different ways, and not all LEDs are created equal, because obviously you've got LEDs on Christmas trees. You're not going to go and stand under those and get a benefit. You've got LEDs on stop-go signs. You're not going to get a benefit from that. It's all LED. But it's particular wavelengths and particular, I'm not going to get into the, how to create an LED machine because that's not us. But there's particular science and clinical studies behind ones that actually work. But LED is used in so many different ways. And I'm not sure, you might already know this, but and I explain this to all my clients, is LED is actually used in dermatology for, the name is skipping me now, is when they're using a particular, oh my God, if any dermatologists are listening, they'll be like, you idiot, say the word. They burn off, they use it, it's called PDT, some photodynamic therapy. There you go. And so they use it in dermatologists for that. Of course, they use it in dermatologists for anti-aging and rosacea and stuff as well, similarly to us. But our practice, we use it obviously for anti-aging. We use it for redness, acne, etc. Even after cosmetic injectables, if you've got swelling and bruising, we use it for that. Or even if you don't, because then if we use it, it minimizes the chance of swelling and nobody can notice that you've had a little tweak in your face. But it's also used in gosh, I'm having a mind blank. The people that fix physiotherapy.
I was going to say, I've heard about it.
We're going to start doing charades.
One word, exercise.
7 syllables. Physiotherapy, 5. So they use it in physiotherapy to actually create blood flow in people that have scoliosis and people that have actually there's treatments through Lutronic, clinical studies through Lutronic, which we use, the Heal Light 2, which have there was no blood flow in the legs. They had pictures, x-rays, gamma, whatever it is, of this person that had no blood flow and couldn't walk. And after doing courses, I can't remember how long he was on it for, but you could see the blood flow within his
That's
legs.
so fascinating.
Amazing. So they use it in physiotherapy for that, but also for sciatica.
Yes.
Oh, yeah.
So my pain and sciatica, amazing. So my mum had sciatica and she was doing all these different therapies with acupuncture and all of this stuff. It's great, and it could have been a combination approach, but she just couldn't get it away. And I said to her, let me do a course of them. So we did it we actually did it in the top of the spine and then also her lower back, because of course we've got, you know, I'm not a physiotherapist, but we've got all those
that happened.
things. Yeah.
all the uppy downy stuff.
Yes.
That stuff.
So it's like hit it at the top, hit it at the bottom, flow through the whole body, right? And she was literally like, and you know, it could be placebo, but it didn't come back. And my mum is bless her, the worst whinger when it comes to anything. And she was like, and she doesn't believe anything. She was like, wow. She's like, I'm pain-free. So it really helps with pain, really helps with migraines, really helps with period pain. And then of course, it's used in pre and post surgical. So if someone's going in for a breast aug or facelift, you use it pre, not just post, pre, because then your skin is healing at a faster rate. So you get less scarring, less bruising, so you're cutting down the post care time, so your aftercare by half.
Yeah.
So it's just, honestly, I could talk about it for hours. LED is absolutely incredible.
Yeah, I feel like it's funny just that you tapped into the physio space, because some of the stuff that's going on with my leg and just the way the muscles are healing, I'm leaning into what other therapies I could be doing for it. And apart from hyperbaric oxygen, I'm looking at getting like an LED for the actual muscle and bone, because of the muscles, there's just so much restricted blood flow. Like I can feel it. Like if I spend a day sitting at the moment, my leg swells and pulls. And it's just the healing process.
Oh my God, I would love to do this with you. Go in there and use the LED lounge. You can have a complimentary, babe. I'll speak to the girls. Go in there and
set up.
Yeah, guys, there's the full LED lounge, so it's almost self-service, but the girls are always there to support you anyway, but it's literally just turn the device on, the instructions are in front of you, and you can put it however many parts of your body you like, really, because it's free for you. Yeah. But you should go in there and use it and let me know what you think, because that'll be great for blood flow.
I'll chat to you about it when I come in next. Yeah, because that's so funny. Like literally that's what I've been looking into the last sort of week to 2 weeks, is what outside the box therapies that are not generally recommended by people for muscle injuries can I look at.
Yeah.
Anyway, we have gone slightly off topic.
But we've dived into our next topic.
We absolutely have. Our next topic was, so we're going to step into in the anti-aging space, but
that was on my list next too.
Yes, but I think we should break it up. LED segues perfectly into this. I think we should break it up into, this is what Jess and I think, spend a lot of time talking about. Hey, Jess, because this is what our clients want to know. And I think this is where women, not all women, I'm not going to generalize, but women and even men and people are just kind of a little bit apprehensive to come to a skin, like a place like yours, because they don't know what to expect in terms of what they're going to be asked to do. And I think I'm fine with, because I love this space, but I think people need to not be afraid. You're not going to all be funneled down one pathway of anti-aging. Like there is so much that can be done for the skin from an invasive, and I call it non-invasive. That's just how I explain it to my clients. And I know you probably got another way of explaining it.
No, I explain it the same.
Yeah. So I feel like I'm in the non-invasive space. Like I've had dermapen done, microderm. I use good quality skin products. That's the space that I'm very comfortable in. But I also know a lot of my clients talk to me about fillers, injectables, Botox, all the other things. And I know Jess and I have talked really heavily about this as well. And just everyone, I think, is just, they put it all together and think if you want to start investing in your skin health, you're going to have to do injectables. And it's cool if that's the road people want to go down. Like most of my friend circle are doing that. But I feel like there's this whole other beautiful space too that people need to not be afraid of. So if you could just unpack that, and then we'll get into the injectables and
yeah. So the anti-aging space, like you say, this is where it can get the whole industry, I think, is quite overwhelming from my experience with when I speak to clients. Everyone's just coming in quite overwhelmed. So my job here is to simplify it as much as I can. I'm all about do as minimal steps as possible in your routine to get you the maximum result. So gone are the days where you need to have 7, 8, 9, 10 products on your bench. I'm a real, like when you say, if you come in for a consult with me, I'll ask you, bring your photo of what you've got. And I want underneath the cupboard too in the back. So it's always my first coaching thing is I want you to throw out everything that's over 6 to 12 months old. Because if it's open and it's over 6, depending on what the product is, 6 to 12 months, it's actually going to cause more harm putting it in your skin anyway. So yes, you don't want to waste your money, but it's actually going to reverse what we're doing anyway. So get rid of it. And I'm all about, like, I always train my team in a confused client does nothing. So if you've got, 4 or 5 products that are great, and that includes your at-home treatment, not just your everyday products, they look beautiful, they're on your bench, you're going to use them because you've only got 5. You're not thinking about which one do I need to finish first. I will go into the anti-aging side, just remind me if I forget, but one little tip for anybody that's listening, if you've got multiple products after you do your cull, if the same product's doing the same thing, I actually went to my sisters and did it and labeled them. I put her 2 vitamin A's that were doing the same thing in front of each other. So she uses the one bottle first. So she still only, with the mind, sees one bottle. That's the only thing that she's using in that line until that goes. Then the next one comes forward. You should only ever be using those, 4, 5, maybe 6 products, maybe. Very rare. So in the anti-aging space, I just want people to go low, go slow, and less is more with their anti-aging routine. That's the at-home stuff. If anybody's thinking, what do I do in regards to anti-aging, I want to unpack the way that I guess the skin works in a simplified manner. If your skin is dehydrated, of course, if you think about a plum and you put it outside and it's dehydrated, how's it look? Like it's lining, it's shriveled. That's what's causing our wrinkles, right? And if you think of a baby and they're all plump, it's because their, collagen and elastin is amazing, obviously, but their hydration is amazing. So if the first thing I work on with a client is hydration, and that's both orally and topically. So your hyaluronic acids. Now, there's it depends who you talk to. There's people out there that say hyaluronic is crap, doesn't work. It's I'm definitely on the belief it works, and I've used it throughout my whole practically adult life. So we want a really nice hydrated skin. Firstly, if you're concerned about anti-aging, the best products that you're going to want in your skincare, I'm going to mention 2, is your vitamin A. So people often call it retinol, all of those, but they're actually just, you probably already know this, guys, it's just a type of vitamin A. So there's different sorts of molecular structures, so to speak, that the cell will be able to take. All right, I'm going sciencey, but high level, Danielle. So vitamin A, everybody should be on a vitamin A. If we think about it like your youth in a bottle. Really good to get some peptides in there as well if you can. And the peptide, I'm not going to go into that. The peptide chain is a very long conversation, but most anti-aging products are going to have those anyway. But a really good vitamin A, I'm obsessed with, is Clinical Range, and I'll talk about that and why I chose them, and then link some stuff for the people listening as well. So your vitamin A is amazing, but don't forget about your SPF. And again, some people say, I don't use SPF, I'm not using it because of the chemicals and blah, blah, blah. You can get a physical SPF if you really like, without the or an all natural one. Because if we think about sun, we know it's our biggest, precursor, I guess, to sun damage and DNA damage. And people often come into the clinic and they have concerns of aging, which, yes, it does look like they're old, but if I actually give them the mirror and is it lines and wrinkles, or is it pigmentation and sun damage? Because yes, you look older because you've got pigmentation and sun damage. It's actually not your lines and wrinkles. So when you're getting all patchy and dull, we can actually brighten and lighten your face. And as off the back of that, you'll automatically get that anti-aging resurfacing kind of result. So if anybody is wanting to go down that anti-aging result, I'm hesitant to say a vitamin C in the morning, because not everybody can handle vitamin C. Like my skin hates it. I break out from vitamin C. So it just depends. Again, that's why I always say, anybody listening, please ring us for a consult. We do complimentary chats over the phone, that we book you in, let us have a chat with you. We don't want your money. We want to get you results. Yes, it'd be great if you're a long-term client, but it's not about that. It's just about taking that complexity away for the client. So speak to somebody, get prescribed properly. In regards to treatments in clinic, my favorite 2 treatments in clinic when it comes to anti-aging is Cosmelan. Again, we'll link it in the show notes. I'll write it down to remind us. Cosmelan treatment is I don't know if I've spoken to you about this, Carissa, but Cosmelan is essentially just high level is a resurfacing treatment, and it is a peel. Yeah. But it gives you, your whole face sheds, but there's barely any kind of, there's no pain. There's a little bit of it feels like a moderate sunburn for 3 to 5 days after. But oh my God, I don't know if you guys can share imagery, or people will see it if they click the link anyway that we put in the show notes. But my skin was literally like, it was a patch of brown. Post-inflammatory hyperpigmentation is the fancy buzzword for it. But it was just a brown patch of essentially melanin pigmentation in the skin when I did fractional laser. Anyway, I did laser at a dermatologist. And I'm prone to pigment anyway. So yes, I did that. And Cosmelan, you'll see the befores and afters. There's nothing like it on the market. I'm obsessed with it purely because it's safe and effective for any skin types except for pregnancy. Safe and effective for any skin types, any sort of pigmentation, and it gives you the results every time. And there's nothing like it that if someone comes in and they're concerned about pigmentation and aging and all these things we've discussed, Cosmelan is sold as the worldwide best depigmentation treatment. So it's in the market for depigmenting, but the anti-aging benefits, the tightening benefits, the decreasing of like that pore size, when you can see the texture, it like just smooths everything out so much. So it honestly, like I've seen 60-year-old, 70-year-old women come in, and I'm not bullshitting, like that takes off 5 to 10 years of their life. And you'll see this in our Instagram if you go into our highlights. Like it's just honestly amazing. And for the price point, I think it's a great price point as well, because in the package you get, it's $1,800 through BC, but we have lots of other things included in the package. I think you can get it in the market for around 15, 16 without the things that we package in it together. But we package it together because you get a better, more efficient, more effective result from it with the things that we've packaged in. But you get like a whole skincare routine. So like 6 products that you take home, and you're good for 3 months. So the 1,800 includes all your product. It's honestly so good. So Cosmelan is one of my favorite treatments for anti-aging, but of course it has the downside of the post-treatment time. There's a lot of downtime. Well, 3 to 5 days. The second treatment that I love for anti-aging is the Is Clinical Fire and Ice. And again, we perform it at BC, and you can get it.
That.
Yeah. How did you find it?
I loved it. Yeah. Yeah. And then that was also the introduction to the skin products that you're talking about that I've now been using for, I think, 4 months or 5 months. That is Clinical Skin product range as well. It's honestly such a nice range. So we stock, and there's awesome, beautiful ranges out there. It's not just what we stock, but we stock Medicate, Mesoaesthetic, and we stock Is Clinical. But I don't know, Is Clinical. I want you to think about, if you think about Medicate, it's amazing. It's a really good, I don't want to say entry level, but if you think about Mecca, Sephora kind of cosmeceuticals, and then like if you think about Drunk Elephant and all of these kind of things, it's nothing. I'm not going to say nothing bad because I don't really like them, but it's better than nothing, right? And you're in a good routine, so that means you're going to use your products that I prescribe you. But then you've got Medicate, that are really that next step up. And then you've got your Mesoaesthetic, that again, a little step up. But Is Clinical is that next step up again. They're just so innovative, and like everything that they use is just of the highest grade of cosmeceutical products. And yes, you pay a little bit more for it, but the product lasts you more because you need less. But essentially, it gets you better results. So it's a no-brainer.
But Is Clinical is more about fixing a concern. So if you think about rosacea and acne and anti-aging things, 100% is clinical. If the person can budget it. But it's like if you think about Rational and what like those kind of ranges that are really high, I personally think I've swapped people out from Rational, and I'm not against it. I've actually never used it, so I don't have much experience on it myself, but I've swapped people out from Rational onto Is Clinical, and they're like, wow. And they were diehard Rational people. Yeah. Yes, going back to fire and ice there's the benefits of it is there's no downtime. It gives you the most incredible resurfacing. So like exfoliating, but super, super hydrating.
Yeah, that's what I found from it.
Oh my God.
My skin
So
just like...
Can I be ignorant and ask what is fire and ice for other people who are like, what? Yeah, not sure what you mean.
Yeah. Fire and ice. Sorry, I should have explained that. So
No,
Fire and ice is a resurfacing treatment. So they call it fire and ice because the first product that they use is your resurfacing. So that's the one that have the beautiful, it's gentle acids that we're using, yet it still gives you the most amazing result. We barely do chemical peels, so to speak, in our clinic anymore. It's always just fire and ice. So the fire component is the part that you feel the heat, and that's the resurfacing part. And then you have this gorgeous hydration cooling system that we put on second. And then we massage with ice globes, and it's just the most, beautiful treatment included. Wow. Obviously, you get your head massage, neck massage, all of that, because that's the BC style. And then you get your light therapy, which works on your cellular renewal. So it's all packaged into. The thing that I love about it, though, is it's only 45 minutes with our clinic. And so you're getting a really incredible treatment, but you're not on the bed for an hour. It's for the people that are on the busier side, because we do have orgasmic facials that are an hour and a half. Which I really love for people looking to melt. But fire and ice is a really results-based treatment, and but with no downtime. And it's something that you would just perform once every 4 weeks and be on a really good range at home. And the thing that I love about Is Clinical is they have these, oh my God, I've got to link so many things, is they have they have the active peel system that you perform at home a couple of times a week. They say every second day if you're doing a course of them, but I wouldn't say every second day if you're doing in-clinic treatments as well. But the active peel system, wowee. It's literally just like the fire and ice in the clinic, except it works out to be, I think, like $15, not even, per treatment. I would love to get you one, Jess, so you can try it. Have you tried them yet, Carissa?
I haven't done the at-home ones, no. I've done the fire and ice facial, and then I've got the Is Clinical. I don't know what I've got. I just know that I've got a moisturizer, a hyaluronic acid, and then maybe a vitamin A or a vitamin C. I'm not sure which one.
Jess, when are you in Brisbane next? Just really quickly.
Haven't booked it yet, but I'm hoping in the next couple of weeks, definitely in the next 4 weeks at the latest.
Yeah, great. I'll send Carissa home if I don't forget. If I don't remember between us, we want to sort out that LED and then also get Jess one for you to try. So I'll send one.
That'd be lovely.
But yeah, just for anybody listening, it's an incredible result that you can do at home, the active peel system, and you can buy them online through our website, which I'll link in the show notes with you guys. And it's really affordable, really cost effective, really good for lazy people because there's no like liquidy products. It's just literally on a pad and you just in the bin. And it's not just about both fire and ice systems, the one that you do at home and in clinic. You don't just get, sometimes you get a microdermabrasion or a facial and after like a few days, 48 hours to a week, the results seem like they're gone. It's like, oh, I was glowy, but now it's gone back to normal. Whereas the fire and ice is not. It's so much more than just surface level. And the thing that I love about Is Clinical, the whole range is safe for pregnancy, which I really want you guys to know this. Because
that's good to know.
Yes, because your patients, clients, do you call them patients?
Clients. Yeah.
The clients that you're treating, if they're pregnant, and they always, majority of people go, oh my God, I can't do anything. Absolutely not. Even when we didn't have Is Clinical, we would say, absolutely, you should be doing a lot of things while you're pregnant because the skin gets so bad and then we have to reverse it afterwards. So never just stop doing everything when you're pregnant, but they can use the whole Is Clinical range, even the vitamin A, because it's non-systemic. There's FDA, they've got FDA approval. Obviously that's over in the States, but it's totally safe for pregnancy. But we always say, if worst case scenario, just to protect our butts, you're welcome to speak to your health team. But we've got it all in writing that it's safe, and you just get really amazing results from it.
Yeah, that's good to know. What about
Mm.
microneedling?
For anti-aging, like
Well,
Dermapen
yeah,
and stuff.
is that what you call it? Dermapen? Yeah, for I guess anti-aging. I know
Yeah.
that it's, well, the little I know is that there is also use as a therapeutic in other ways, but yeah, anti-aging as well. Like I think pigmentation is something I've heard about it being used for, but I don't know if that's right. You can see I know little, but is it called Dermapen?
No, you guys honestly underestimate yourselves. You know a lot. It's great. And majority of people do know a lot that come into the clinic these days. So it's like people have more of an understanding. So Dermapen is just a brand of skin needling or micro needling, whatever you want to call it. Same
Right.
thing. So Dermapen is just the brand that they use to do the micro needling. So there's many different systems or pens out there that you can get that are, I would say, just as good as Dermapen. We don't use Dermapen at Bobbie Charles. We use the mesoaesthetic pen, and we get great results from it. Yes, it is definitely an anti-aging treatment, absolutely, and we get incredible results from it. And in our treatment that we perform at Bobbie Charles, we include a lot of people say I'm so obsessed with this. A lot of people say they use active ampules and stuff, infusions you see. Sorry, guys. Infusions you see on the infusions you see on their list. But, and this is what I explain to clients, yes, you pay more at Bobbie Charles, but this is what you're getting. This little bottle for us costs us $300-400 in this bottle, and you're getting a mil of it infused into your skin while all those channels are open. Because a lot of people, and again, you don't know what you don't know. As a client, you don't see, you're not looking. Plus, as a therapist, and they might be working for a business owner that's all that they give them to utilize, is they could be using a hyaluronic acid, which most of the time that's what's infused, a hyaluronic acid that's been open for 6 to 12 months, or they don't even have a date on it, so they don't know how long it's been open for starters, and they're infusing it into a bloody or an impaired area for starters. But then also, you don't know how long it's been open for, so it could be off. How many people have it's oxidized? Has it been touched on people's hands while they're doing cross contamination and infection? So what we use is a pure, like it's built to be infused in the mesoaesthetic pen. So we use straight hyaluronic acid, which, as I said, costs $350 or whatever for a bottle. But we also use peptides and things that act as, I'm not going to say as a Botox, but very similarly to the way that a Botox, or not Botox, anti-wrinkle works. So, with anti-wrinkle, how traditionally you're normally getting it in those 3 zones or whatever, and, maybe a little bit around the chin. You're not really doing anti-wrinkle anywhere here, whereas that's the majority of our face. So when we're skin needling, yes, you can still go and get your anti-wrinkle. I do. But when you're skin needling, you get you're getting a whole skin needling with that mesotox or peptide solution, whichever one we choose, throughout your whole face. So the whole canvas.
Yeah, I'm so keen. I've done skin needling quite a few times over the years, just courses of it, and I've seen great results with my skin. The only thing I would say is that downtime that you talk about, you do get a bit of a peel afterwards. When I've had it done, I haven't had it done through you guys, but I'm keen as fuck to do that.
You won't get as much downtime with us.
Yeah,
it's very rare. I mean, you are quite prone to redness though, right?
Yeah, and dryness as well. So.
Yeah. So because of the things that we infuse, and traditionally, how long ago did you have it, Carissa?
I haven't had it done for over 24 months now. So,
okay. So traditionally, and even now, depends where you go, the old school way was we want to see blood.
Yeah, I think blood. I remember blood.
No,
not heaps of it though.
So for us, like your skin type, because you're not prone to pigmentation, we might be able to go a little bit deeper. But my team is so incredible. You don't have to go in and see me to trust this process. But I train the girls in, again, go low and slow. There's not always, like with you guys and, anybody else that prescribes things, there's not always a need to go excessive.
Yeah.
Let's see how your results are from your first one. And do we actually need to go deeper to cause that much trauma to get us the result that we're wanting? It's not always the case.
Yeah. I'm going to say out of the 2, I've done a lot of stuff for my skin, not as much as my sister, but the 2 things that I have really noticed very significant change from in terms of just surface, hydration, glow and things like that. Personally, because I do look at my skin under a microscope, like I am a bit vain about it. But the things that I have really noticed massive changes from is needling. So I'm not going to say dermapen because I didn't realize. I thought dermapen was just better. So needling. I've noticed when I've done that regularly, my skin, I've noticed significant changes in just the texture, the plumpness of that from needling, and also the Is Clinical products. Like they're the two things.
Wow.
And my gauge for this is my sister, because she is a mole about skin, and she will tell you if your skin is shit, and she will tell you if your products are shit, and she will tell you if she thinks you need an anti-wrinkle injection somewhere. She does not hold back, but she knows. So she is my gauge of whether or not I'm doing something right with my skin or not. And the two times that she, like, every time I've seen her, probably for the last, since I've been using these clinical range and seeing you guys, she has commented on my skin so much. She is like, whatever you are doing, which makes me so happy, because she is a hard woman to please when it comes to skin. And when I was getting micro needling, they're the two times where she has pulled me aside and said, what the fuck are you doing with your skin? It's so different. It looks really good. So, like, and I feel like I have done quite a bit. I've done microdermabrasion, and over the last sort of year, like I was saying, 5 to 8 years, I have really invested in good skin products, or what I've deemed to be good skin products, and I do believe they have helped and stuff. But they're the two things I can say over my more, involved journey that I have seen results myself, but also had my hardest critic, but also my most invested skin on family member comment positively. So.
Oh, that's very funny. No, but we all need people like that, right?
We do.
At least we know that they're straight shooters.
Yeah, she's my no bullshit gauge. Like, if I'm looking tired, like she's up me all the time for drinking coffee. She's not a coffee drinker. She won't drink it because of her skin. She's just like, dehydrate your skin. I'm like, fuck off. I'm drinking coffee. But
I'm not a person when I don't.
Horrible person when I don't. But yeah, she's at me all the time, and she was the person that introduced me to SPF. She was saying to me from when I was 20, like, you must put an SPF 50 on your skin. I'm like, I don't need to. And then she spent her 20s in Ireland, so away from the sun, and I spent my 20s in Queensland in the sun, and significant differences. So she's always used a really good SPF and prioritized good skin products. And yeah, there's definitely anyway.
While I think about it, I'm going to give the people listening a tip, because that reminded me when you said Ireland and here, is in Queensland we see so much. Our patients that we'll treat, they'll treat their face with incredible products, and they won't treat the neck. And then so the neck is so you'll look maybe 40 here, maybe 45 here, but then you'll look 50 on your décolletage.
That's me. That's me.
You do not.
I've got wrinkles. You know, for the people that side sleep.
So you could be using a vitamin A now.
Yeah.
And SPF on your décolletage.
Can we micro needle my décolletage?
Yeah. No, definitely. It's but you will see that you get quite a quick result on the neck. I mean, on the chest, because you haven't done anything to it before. So you'll get quite a quick result on it. You'll notice that you'll stop getting those lines. And I always try and tell everybody, sleep on your back anyway, because
it's so hard. I'm such a little side sleeper.
Me too. Get comfy.
I feel like Queensland high schools have got a lot to answer for, because all of our uniforms. Jess, were you high school down there? High school up here? High school down there?
High school Victoria.
High school Victoria. So I don't know if it was the same for you guys with sun exposure, but all of our Queensland high school uniforms had the V with the tie. So none of us were sun smart 25 years ago when we were all finishing grade 12. Like, I was, I was going, but yeah, so I feel like a lot of it too is like you just had this constant, this V of sun damage, and then you side sleep, and then all of a sudden you're 40 and you've got the décolletage of a fucking 80-year-old. Like,
you're so funny. I love it. I want to jump into some, I guess, a holistic approach, if you guys will let me, in regards to like what can make people glow and just look their best within their skin. Because it's not always, I know I'm here to talk about skin treatments and products, but again, this aligns with you guys in the approach that you take is, we spoke about limiting sun. as much as you can. But I'm a sun lover and it makes me happy.
Same,
So if I go
same.
to Bali, I'm in the sun, you know it. I put SPF on every day, but because I'm prone to pigment, I'm going to get it back. But I just do Cosmelan treatment every 6 to 12 months and it's gone. Because Cosmelan you can do every 6 to 12 months. But I just know I'm going to get pigment, whatever. I'm going to have fun and I'm going to be sandy hair and I'll come back and fix it. But limit sun as much as you can. But in saying that, get sun first thing in the morning on your face. I know some people are going to go, eek, but absolutely not. As you've taught me, Carissa, first thing in the morning, what's it do for your internals?
The cortisol, dopamine.
Yes.
Yeah. So we
It
talk
kickstarts all that.
Kickstarts
the
everything.
engine.
Just that morning sunlight, guys.
Yeah, morning sunlight, just even for 15 minutes into your face. A couple of other tips as well for people listening is, and I know it sounds common sense and can be sometimes hard, but we know that stress has a major impact on our skin. Like if you look at a woman or a man and they're going through a shit ton, like a breakup or a new business, their skin looks like shit because firstly they're stressing a lot and they're not eating well. But it's so important to make those small or big, however big you do them, adjustments to your life. So we want to change, again, this is your guys' field, but you want to change the way you look at food. So food is not about, for me, not about calories so much. It's about nutrition and it's about like a wholesome way to actually serve my body, because my body serves the shit out to the world every single day. So for me, it's just about serving my body when I'm eating, and it's that mindfulness around eating. So trying not to be on your phone and trying not to do a million things. Take your food away and actually sit with it. Slow down as you eat. And then also making sure that we have really good sleep routine. So for me, it's like, last night I went to bed later. I was literally in bed thinking, oh my God, I can't wait to talk about this and about this on the podcast. But normally I'm in bed by 9, up around, 5 o'clock. And it's a really non-negotiable for me, because that's when everything reproduces from a skin perspective as well. You want to be making sure you get a really good sleep as much as possible. So making sure that you're, limiting that blue light before bed. Honestly, I know it's hard to change it, but when you do, wow, you'll be so thankful. Like just an hour, like I've set all on my phone. I love to automate everything. I've set my phone. Sorry, my God.
Oh, good.
Sorry.
That's okay.
How do I turn this on Do Not Disturb? I wonder if I put this on. It is on Do Not Disturb. Okay, I've trained him to call twice if it's on Do Not Disturb, because it's always on Do Not Disturb. Put it on airplane mode. What were we saying?
Sleep. We're talking about sleep.
Yeah, so if we're getting really good sleep and we make those changes, automating your life. So like for me, my phone goes into sleep mode, so no one can call me. I can't call. Notifications are off. The screen size goes, the screen color goes into night mode. And I also make sure I limit, phone use throughout the day as well. So I've got like the timers set on all of my apps. So it's 15 minutes most on Instagram per day. So I can't just keep scrolling and, all of that sort of stuff. So you can use your device to actually support you rather than be an enemy. And then just I'm a really big one for this, is always having a break locked in, because I know, again, this is not skin treatments or product talk, but if you take, I don't know, I love women. I always talk about women. Let's forget about the men for now. If you take a woman and you give her great products at home and you give her a skin treatment every 2 to 4 weeks, she's going to look amazing. But if you get her in her body, if you get her less stressed, if you get her well nourished, if she knows she's going on a holiday in 3 months, like she is fucking glowing, and that's what we try and do at BC. It's all about that holistic approach and, coaching them through small changes over time. And it doesn't happen overnight because it's habitual, right? It takes time. But it's just those small adjustments all the time to get you living or being your best self, so to speak, and get you glowing. And because you get better results, right? From your skin treatments and your products when you're doing all of those things. Again, it's a that holistic approach.
Absolutely.
True. So true.
So what about, Carissa mentioned it before, the difference between non-invasive versus invasive. So I'm not sure again if that's the right way to look at it. But again, clients will ask us about Botox, about cosmetic tattooing, fillers, like that. They want to know from us. Often I would say one of the more common questions is like, is it safe? Like what am I putting into me if I'm going to look at this? So there's that we get from our clients. And also just as women living in the world, like it's an option now for any of us, if we want to. And Chris has talked about with her, even with her sister, I'm sure, like you have her literally coming up to you and saying, you need to get this. And my sister ironically does the same thing about certain things, that she'll be like, why don't you get this? I'm doing this. You'd be great if you just went and got this and this done. So yeah, I know, right? Like, thanks. That's great. I didn't notice that, but now I'm hyper fixating on it. So I'm so keen, and I know our listeners will be really keen to hear like your thoughts around this space.
Yeah. So if you're going into more of I'm going to talk about, I guess, what we offer at BC. So it's your PDO thread lifts, and because everyone always comes in and says, I want to look like this, just lifted. So you've got your PDO threads. You've got your different sort of collagen stimulators, which are nurses. This is all in the nurses bucket now, not in a dermal therapist or a beauty therapist bucket. So they've got lots of different tools that we provide. So there's things now that you can provide biostimulators, for example, to stimulate your own collagen, which is a long-term kind of effect. I guess I don't want to say it's natural, but it's more of your, body doing its natural thing. But going just to the most known thing, your anti-wrinkle and your fillers. When people say, is it safe? Well, it wouldn't be allowed in Australia if it wasn't.
Mm-hmm.
Now, for it to be, it's a toxin. For it to be toxic, you need to have that much. I'm not a nurse, so this is from my knowledge and my education only. It's not medical advice. But to have you have it as a toxic thing, you cannot physically give that much of a dose to a person anyway. So that's the whole side of, is it safe? Is it necessary? Is anything in life we do necessary? But I think if it makes you happy, do it. Like there's so many people that I know that are on that whole natural journey, and they talk about the natural journey, which again, there's no judgment, but they won't talk about that they have their anti-wrinkle because they're non-toxic, but they actually get anti-wrinkle.
Yeah.
Can I just say, I love that you say that, because I fully respect anyone's choice with whatever they want to do in this space.
Absolutely.
And like you said, like, is it necessary, or do you just want to do it? Like, we all have our little things that we want to work on. Like for me, it's my teeth. That's something I'm going to invest some time and money in. My sister has been getting Botox, anti-wrinkle, all the things like for the last decade, and she just loves it. She wouldn't live her life any other way. I've had friends that have dipped in and out of the space, friends that absolutely love the space. Myself personally, I haven't dipped into the space, but I just think do what you want to do, but just be fucking honest about it too. That's I think the thing that irks me a little bit about that, as soon as we get into fillers, injectables, and Botox, or what I'm probably using the terms interchangeably the wrong way, but anyway, you know what I mean, is that there's a lot of people saying they don't do it, but they do, and it's just like, no, I just eat well. It's gaslight. It's like, no, I just eat well and my skin just looks like this. It's like, no, you've had something done. Just fucking own it, man. Like, no one's judgy about it.
Yeah, like, I agree, honey.
I think that's my little side irk on it.
Yeah.
But I feel like, like I just look at, again, I look at what my sister's done with hers, and freaking amazing. Like she doesn't, it's not unnatural, but it's like, it's
and there's absolutely no need to be judgmental against anything I can do in life. Let's be real, we're all different.
No,
but there's enough shit that we need to be judged about as women. Like, leave us alone. If we want to do it, we're doing it. But I think, again, coming back to your sister's thing that you were just saying, is it's all about moderation. Like for me, I'm a walking advertisement of BC and my brand. It's like, imagine if you see me looking like shit on the street, you'd be like, oh, I'm a presentation of my aesthetics clinic and what we do and how well we do it. So for me, it's always, it's an investment, I say. But yeah, going back to, is it necessary? I mean, if you, again, it's that holistic approach. Like I will be seeing a patient for, or client, whatever you want to call them, for skin. And if my nurse is free, I'll say, you're open to speak to my nurse. There's absolutely no obligations, but we'll see what she can do from the anti-aging approach. It might not be now, but at least there's somebody that you know that you can trust when you're actually ready to go down that path. And she'll talk about, it's the whole, client journey from a holistic approach to what we can offer them as a brand. But all about moderation, and just don't go overboard, but I'm so honest about what I've had. I don't know if you've seen it. I put up a post on my Instagram the other day saying I had, and it would be looked at as quite a lot, but I still think it's very aesthetically pleasing. Like, it's not like I've got these crazy ass cheeks and this crazy ass jaw, and like, yes, I've got big lips at the minute because I make her. I'm like,
you love your lips though. That's what you said. You're like, I love my lips, and I'm like, yes, I love that.
Absolutely. I'm like, pump me up, babe. And because it fucking hurts, for starters, and I'm not coming back in your seat for an extra 6 months minimum. I don't want to see you or your face. Like, you should see when they inject me. I'm like, if looks could kill, I'm like, I hate them for that for half an hour, but afterwards I love them. But yeah, I had a little bit in my cheeks, a little bit in my jaw, which I'm so glad. Nurse Tennille that we have as our advanced injector currently, she just looked at my face from like a whole aesthetic approach, whereas normally I go into a place and say, I want my lips because that's what I want, right? But she was like, ask me the question so gently, do you mind if I take a whole aesthetic approach on your face and let you know if you were to tweak this? It's not about telling you things that you don't know. It's not about saying you look shit and you need anti-wrinkle. It's like, if I was to put, the way she described it, I've never had in here, or I've had in here done before and I hated it for some reason. I was like, nah. She's like, I have really quite heavy here. And she said, if I put a tiny little bit of filler here, it's literally just going to open it up a tiny bit so you don't look as needing this. And when she explained it to me and pulled my face in the mirror and stuff, I was like, that is a no-brainer. Why has no one else told me that? I was like, go for it. So I had a tiny little bit here. And I found that and we're always on our phone for starters, so our chin's disappearing anyway. I found when I was starting to walk around, I used to have to like strengthen my neck up and lift my chin because my chin was starting to disappear, which is common as we age. And she said, let me just put a tiny bit in your chin. And I trust her fully. And she did. And I don't have to, like, when I'm looking in the mirror and stuff, it's just got that nice proportion. So yeah, I think if you go to, again, somebody that you trust, and we'll unpack that, it's like, how do I know that I can trust this clinic or this person with my face? Yeah. But yeah, go to someone that you trust for sure. And don't rush into anything,
Yeah, such good advice. Because you went in wanting the thing, hey, what's the thing that you said where they put, I feel like I've seen it done online a couple of years ago when they put like and they just sort of do that face pull back.
Yeah, and I will get it eventually. Like, I know that I'm going to do some sort of facelift at some point in my life with a really fucking good surgeon. Like, I'm not that there's not good surgeons here, but I'll be going overseas. I really love I don't like the full fox lift. Have you seen the ponytail lift, the fox eye, where it's like a straight eye online?
No, I think I've seen it on watching. I'm a bit obsessed with watching Real Housewives as my downtime, so I think I have definitely seen it on there.
Well, I don't want like the full fox eye. I think it would be weird, but I just want a little bit of the, bottom side lift. Not now. I've got things in my toolkit that can support me, but maybe when I'm 45. I'm only 25, so I've got 20 years to go.
Love it.
But no, I will eventually go down that path. I just want to, not that I don't love getting old. Somebody said to me once, oh my God, we're so off topic, but someone said to me, aging is really like a blessing. Like, not everybody gets to age. And I was like, that's so true. Like, every day it's another, it's a blessing to have another day above ground, I always say. So aging is a beautiful thing, but what if you've got access to it? Why not? Yeah,
well, like we've said, you can choose to be the version of you that you want to be, that makes you feel best about yourself. And that is going to differ from person to person, and there's nothing wrong with that. And you can age into your 80s, 90s, if we're lucky, and do that in the way that you want to do it. Like, there shouldn't be any judgment in whichever way that you choose to approach that.
Yeah. Can I add one thing? Do not do. Do not rely on anti-wrinkle and filler as your anti-aging solution. Absolutely not. Throw it in the bin. Because if you've got a shit skin texture or tone, you're wasting your money. It's going to give you a quick
that makes
fix,
sense.
but you're not going to get that result that you want. You just don't. So if you're working with a nurse and not going to BC and all she does in injectables, she doesn't do skin, please go and see somebody that does skin, because you're going to be so much happier with the money that you're investing. And similarly, go and see JCN, because you guys do your virtual stuff, to actually get some support on internals. Because with all three, your cosmetic, your more of your cosmetic nursing side, plus your skin, dermal, beauty therapy side, and what you guys do, wow.
Yeah, no, a good point. Well, I think our last question before a few quick rapid fires, we're like, I feel like we could just talk all day. And you just touched on it, was how do people know who they can trust with their skin?
Yeah. I would say do your research first, word of mouth. You can check in on word of mouth. Where's everybody going? But that doesn't mean, I personally think you need to fall in love with the brand, not in as one particular therapist. Now, do your research from afar would be obviously looking at client testimonials, but you don't just want to look at, like, if we open Bobbie Charles now, there's 200 or so 5-star reviews, but you don't just want to look at that, because they can be fake, they can be bot done, whatever. You want to actually read what people say. Is it really about skin, or are they a brow place? Look, and then so you don't want to go to a place that's fucking really good at brows and lashes and then start doing all these Cosmelans, because they might not be educated on that. So look at the reviews and actually read them. And then when going for a consultation, please do not let anybody touch your face until your consultation is there for you to see what they know as well. So you ask the right questions. So how long, with BC, we take 5 minutes or so of that consult to explain, hey, this is my name. This is how long I've been in the industry. This is my passion with skin. We're all trained in the same technique. You can trust us all. We all take notes. But a portion of our work is around education within our brand. So we all have the same philosophy, like all of that. So you'll get that anyway with us, just to gain that trust. But if you go into another clinic, it's not always in the process. It's very rare in the consultation process. So ask them those questions. How long have you been in the industry? Do you know, is skin something that you guys predominantly do? What ranges are you using? And so you as a client might not know if that range is good. So again, doing your research online. But that's why I always say you have to trust the founder. You have to trust the brand, because I know that my clients that have been coming to me for nearly 10 years, whatever I decide, they know I've done the research, I've trialed it, I've tested it. I will not stock anything on my shelves that I'm not obsessed with. I just won't. So you need to fall in love with the brand. You need to do your research on the reviews. But then whilst you're also, before your consultation, if we take a step back, you can actually look online for the brand's kind of philosophy, I guess, and their values in the brand, and do they have values around education and that kind of thing. And you can actually, in our BC website, you can go into each of our staff members in our team. I'm so lucky, I've got the most incredible team. If you go into there, you can see what awards we've individually won in the industry, because it takes a lot to win awards. This isn't fake stuff. You've got to jump through hoops. You've got to prove your results. You've got to prove your philosophy and the education and the impact that you make on your clients. So look at the awards that we've done. We or anybody else that you're looking at. Look at the awards, and then also look at the awards of the brand, and then also not just the awards, the education. So what education has that person had? Now, you can take a beauty therapist and a dermal therapist and a dermatologist, and you can have a beauty therapist that knows more about skin. I don't want to, some people listening might, if they're in the industry, they'll want to shoot me. But there's honestly some derms that I would never let touch my skin. And there's some beauty therapists that shit all over some dermal therapists because they've put in the work. I can tell you right now that, and it's not big noting ourselves, but if you take one of my beauty therapists, please don't, but if you take one of my beauty therapists and then you put them into another clinic, even my lash and brow techs are trained in skin. Like if it comes down to like how much education that they've had. So it's not just about I'm a dermatologist or a dermal therapist. When I say education, it's ongoing training. Who are their mentors? Are they continuously, listening to podcasts? I mean, you don't want to interview the clinic when you're doing your consultation, but you'll know, but when you're doing that consultation. So they're the things that I would personally look for. And also the client care. What happens if something goes wrong?
Mm-hmm.
They're the things that you want to make sure, like, that you're going to be looked after from start to finish. And are they all about sales? Like, yes, we prescribe, but I can tell you right now, if someone's not authentically selling in my clinic, it would never happen anyway. But it's not about getting your money quick. It's about having you for life. And that's our philosophy, is relationships for life. And that's the only way you gain that is through trust, right? And getting client results. So again, like, you want to make sure you're not going to a clinic that's really speedy, really rushed. And another thing that I would look for is the culture, and that's why I invest so much in my culture, in my team, is if you get, like, in March, we're doing March mindfulness, where we do meditation every morning as a team. If you get a therapist that's really in her body, really relaxed, imagine how her brain works. She can fire on all pistons from a calm space and give you the best results, and she's really present with you. Whereas if you get someone that's being abused and treated like shit by the owner or the team's shit, they don't give a shit about you. They're thinking about what we're going to do for a career. So personally, and that's why I say fall in love with the brand.
Yeah, that's so well said. It's honestly, I feel like too, it resonates with me really deeply, the way I feel about JCN Clinic. Like, you couldn't have said it more
I'm
poetically.
honestly 100%. I'm so lucky to have, like, that you allowed that, Jess, for this collaboration many months ago. I'm honestly, very, very grateful.
No, I love it. I absolutely love it. Do you have time for these last rapid fire questions, or should we wind
Just do it real quick. Hit me up.
Okay, I'm going to hit you real quick.
Rissy.
Okay, we have 2 questions that came through Instagram. Question number 1 is, what is the single most important thing you can put on your face every day? Danielle, go.
SPF, 100%. Yeah.
Beautiful.
Yeah.
Okay, and I feel like we probably have covered this, but anyway, is there really anything natural we can do for wrinkles that works quickly?
I'm going to go back to that wholesome approach of get better sleep, get better diet. They're all the real natural things. But if you think about is clinical, they're 90, or I'm not going to tell you the exact percent, because if my trainer's listening, she'll be like, no, you're 2% off. But it's majority botanically derived. So if you're thinking about something that's natural, because a lot of people want natural products, but I'm not going to go into this too much, but I'm not always a firm believer in natural wins, because it has to be, for me, you're not going to go out and get some plant and rub the root extract into your face. Like, that's
something Carissa and I would do.
Maybe aloe vera, great, because it's great for sunburn.
Definitely done that.
Of course. But, like, you're not going to get an orange and be rubbing it for vitamin C. Like, well, maybe avocado. Like, you can do all those natural things. But if you get a range that's really botanically derived, you have to remember that these people are, I don't want to say scientists, biochemists, whatever they are. I'm not. But if you get somebody, if they do what they do really well, the reason why it has a small amount, I don't want to say fillers, because fillers get a bad word, but they have other ingredients to actually make sure that the delivery. Yes. So it's the delivery mechanism within the product. And it also keeps it stable, because if you get a vitamin C and an orange and leave it outside for 5 minutes, it's oxidized, right? You're not going to rub an oxidized vitamin C in your face. It's going to destroy your skin. So, like, they have to make sure it's stable and it has the right ratio where the clinical studies have been done. And I will add, I have no endorsement from Is Clinical at all, but Is Clinical, the way that they do things, every product before it goes on the shelf has clinical studies on it. So a lot of people will do clinical studies just on the actual ingredient, whereas Is Clinical, and I think they cost tens of thousands. I don't want to say hundreds of thousands, but maybe tens of thousands per product to do clinical studies. So a lot of it goes into that. So you know that the product that's on the shelf is working and it's stable. So to the person that's asked for a natural response, there's absolutely no judgment there. If you want to fully keep it natural, just do as much as you can in regards to sleep, diet, hydration. You know, take a Buddhism life, slow and simplistic. You know, otherwise there's lots of ranges that are beautiful that can support that.
Wonderful.
Fire and ice, you know.
Yeah, I feel like even what you said there, like just I feel like just understanding that the natural skin approach like has levels as well, I think is like you said.
So many
like
people that use natural products have sensitivities, like because they're not stable or because they're, you know, it's not always the best approach.
Yeah.
Wow. Thank you so much. This has just been amazing. For listeners who want to know more about Bobbie Charles or yourself, where can they find you and Bobbie Charles?
Yeah, so anyone can contact me at my personal playground on Instagram. It's not all about skin and business as much as most of it is on there. I do have a lot of fun. But yeah, you can definitely please reach out to me at any point or any time with any questions. And it's Danielle_Bobbie Charles, and it's spelt with Bobbie. A lot of people spell it with a Y. So Bobbie Charles. Otherwise, yeah, you can go straight direct through the website, and it's Bobbie Charles AU on Instagram. Otherwise, you can look on our website, and again, it's just bobbiecharles.com.au, and you can reach out to any of the team. They will always treat you so well. Like, you don't have to come straight to me. They're all so passionate about what they do, and I can trust every single one of them. So, and yeah, what else? I mean, we have that option for virtual consultations. So no matter where you are in the world, if you want to have a chat to us, you can certainly book that online. For any of our treatments, whether it be cosmetic tattoo, cosmetic injectables, or skin, and you can speak to an expert in that field and then fly up. We have people that do that from interstate, so you can do that, or just a simple phone consultation. We're just a big about human to human. You know, get us on the phone, let us support you, and then we can take that next approach on your journey.
Love it, and we'll link all of that in the show notes too.
Thanks.
Thank you so much. This has been amazing. It's been an hour and a half, and I think we could have kept going if all of us probably didn't have other things to do, plus go to toilet and eat.
I have to wee. That's top of my list.
But yeah, I can't to thank you enough and appreciate your time today. It's just been fantastic.
Oh, no, thank you so much for having me. I appreciate it.